Joining me today is Dr. Carl Freeman, orthopedic surgeon at the Jacksonville Orthopedic Institute. Doctor, thanks for being here.
Thank you for having me.
Well, I know the Jacksonville Orthopedic Institute, they have athletic trainers and of course, orthopedic surgeons all over Northeast Florida, and a lot of them active with various schools in the community. And tell me a little bit about where you are. I believe you're over at Paxon, and exactly what you do for Paxon.
I'm the sports medicine physician for Paxon, and I cover all of Paxon's sports, especially their football team. I've been present at their football games, their varsity football games this past year, and this is the first year I've covered Paxon.
What's that been like for you?
It's been great. It's very rewarding, and I really enjoy that school because the kids are really smart and really kind of involved. The school has really done a great job in terms of its facilities and turning things around and trying to make a big name for itself, and they've really done a great job at that.
Well, and you are at all the football games?
I am.
Well, that has to be a long Friday. I know most people probably are thinking, well, these orthopedic guys, maybe they have early days on Fridays, but Friday's probably a long day during football season.
It is. We attend all the home games, and it can be long days.
What are more of the common injuries that you're seeing in football today?
You know, it's typical. Knee injuries are the most common injuries in football, but you'll catch some interesting things, like I've had a few shoulder dislocations and hip injuries.
Any opinion? I know the talk today, and it has been for the past several years, is concussions. And that's really, gosh, I guess the last really 2 or 3 years that's been in the limelight, so to speak, or in the media. What are your thoughts on football and concussions?
Well, a lot of us are very concerned about concussions in football. Clearly, the NFL has drawn a lot of attention in management of concussions. The key is identifying concussions quickly and treating them correctly, but in addition to that, there's a lot of focus now on proper tackling technique.
And what's the protocol? I mean, if you're at a game and there's an athlete that has a potential concussion, you'll evaluate them and decide whether they should go back in or not?
That's right. And nowadays, the type of people that we probably would have let go back in to play 10, 15, even 5 years ago, now it's turning out that that's the wrong move, that we should keep these people on the sidelines and hold them out of play. And if the concussion is severe enough, then we go ahead and transport them to the ER, the hospital, for evaluation.
Well, I guess being conservative, being cautious is the best mode.
It is. It turns out there are long-term consequences for a lot of these severe concussions.
Well, that's great. Doctor, thanks for being here today, and I know Paxon is glad to have you being there, keeping their athletes back in the game.
I'm proud that they have me.